Hi, and welcome to the Traditional Chinese Medicine lecture. My name is James O'Sullivan, and I hope you find this lecture useful. Today we're still on the subject of yin and yang, and just to recap on the five main aspects of the relationships between yin and yang. First of all, we have yin and yang as opposites. Then we have the interdependence of yin and yang, where one depends on the other. We have intertransformation of yin and yang, where one transforms into the other, such as day transforms into night, and so on. And then we have infinite divisibility, where you find the seed of one in the other. In cases of pathological, let's say, yin deficiencies, we would always have symptoms and signs of a yang deficiency also. And today's lecture is regarding the mutual consumption of yin and yang. First of all, it's important to say that mutual consumption is the most important aspect of the yin-yang relationships regarding our clinical treatments. When we have an excess of one, it will consume the other, as we will see in the examples to follow. When yin and yang are balanced, you have optimum health. And as I said before, when homeostasis is balanced, you have optimum health. So the yin-yang relationship or the yin-yang balance is identical to homeostasis, or the view that we have of homeostasis in Western medicine. In other words, it's the body's equilibrium. Let's just look at a diagram. Diagrams are not great when it comes to describing Chinese medicine, but this is probably the best diagram that I've come across. Here we see this line on top here, and this is optimum health. This is what we need to achieve in order to live a healthy life. And of course we have equal amounts or equal quantities, equal qualities of yin and yang. And when we have equal qualities of yin and yang, we have balance. However, that's not always the way it is in life, as I've said to you in class. Let's just look at a disharmony of yin and yang. And here we see we have an excess of yin. As a result of this excess of yin, we have consumption of yang, so therefore we have a reduction of yang in the body. So again, our balance line is here, and anything above the balance line would be considered an excess in the body. And when we have a deficiency, or anything that's missing below the line, would be considered a deficiency. So here we have yin consuming yang. And this is considered full cold in terms of a diagnosis, according to the theory of traditional Chinese medicine. Cold limbs, there would probably be weakness or fatigue, contracture, pain that's improved with heat and warmth, and the tongue would be pale. Also, the pulse would be slow. And in this particular case, the pulse would also be full as well. And we would probably have a bluish hue on the tongue as well. For now, think about the tongue as pale with a bluish hue, and the pulse is slow and full. The next pattern we're going to look at would be where we have, instead of having an excess of yin, we have an excess of yang. And as a result of this excess, we consume some of the yin. In terms of Chinese medicine, this would be considered full heat. In some cases, we would also consider this as yang rising, or hyperactivity of yang. In terms of clinical manifestations, we may have restlessness. There would probably be a headache, irritability, and the pain is worse with pressure. And of course, the pain would also be worse with heat or in hot situations. The tongue is red and the pulse is full. And another quality attached to the pulse as well, the pulse would also be rapid. Another pattern that we need to look at is where we have our balance line is here. And of course, yin is normal in this case, but yang is deficient. So in this case, we call this particular pattern, it's called empty cold or yang deficiency. So again, as I was saying to you in class, our main principle of treatment in this case would be to raise yang. And when we look at the clinical manifestations, we can see that the patient would be feeling cold, probably have cold hands and feet. There would be fatigue, weakness, and pain, and that improves with heat and pressure. The tongue would be a pale tongue, and because it's a yang deficiency, something that we'll go on to discuss later on, the tongue would be wet and probably swollen as well. And the pulse is slow and weak. The next pattern we're going to look at would be where we have a normal quality of yang in the body and a deficiency of yin. In other words, yin is not enough to make up the full balance. And in this case, what we call this is empty heat. Our diagnosis would be yin deficiency. Again, we're looking at an absence of moisture here. The patient would be feeling hot, particularly at the yin time of day. This is in the evenings or at night time. There may be night sweats. Heat in the 5 centers or 5 palms. That's the palms of the hands, soles of the feet, and center of the chest. And we may have restless insomnia as well. Again, the restlessness would be caused by heat or feeling overly warm at night time. Again, this is just looking at a very simple pattern of disharmony called yin deficiency. And the tongue would be red without a coat, or it may have geographic coat. We'll discuss all of those later on in the course as well. And the pulse would be thin and rapid, or empty and rapid. The empty, thin pulse giving us the clue that there's a deficiency here. So when we look at mutual consumption, we can see our 5 cases here. The first is balanced, which we won't see in our own clinics. The second would be empty cold or yang deficiency. The next is full cold. It's where we have an excessive cold in the body. Our next pattern would be empty heat or yin deficiency. And then our next pattern is full heat, where we have a full pattern. A little about the 8 principles. And as I was discussing in class, I was saying that without these 8 principles, it would be impossible for us to diagnose properly according to the theory of traditional Chinese medicine. So there are 4 basic questions that we need to ask when we have gathered all of the clinical manifestations of the patterns of disharmony. We need to ask ourselves, is it interior? Is it exterior? Is it a deficiency? Is it an excess? Is it cold? Is it hot? Is it yin? Is it yang? And we can already answer most of those questions, with the exception of interior, exterior, for now, based on the information that we've had in the 4 previous patterns of disharmony. So for your own enjoyment, let's just take a look at Peter, who's 23 years old. He's a welder, and he presents to us in our clinics with headache that's worse in a hot environment. He's fatigued. His stools are quite smelly. He has dark yellow urine. The tongue is red and dry, and the pulse is rapid and full. What's your diagnosis? What's your principle of treatment? And I know it's a little early to ask you about prescription of points, but you can look them up in the book once you have your diagnosis and your principle of treatment. The next case history that I'd like you to look at is Petra. And Petra is 24 years old. She works in an office, and her presentations are a headache that's worse at nighttime. She's also feeling fatigue. She has smelly stools, yellow urine. Her cheeks are red, and she tosses and turns at night. She feels hot at nighttime, and her tongue is red. It has no coat, and her pulse is rapid and empty. Have fun answering those questions as well. What's your diagnosis? What principle of treatment would you use? And what prescription of points would you use in order to help Petra?